The COVID-19 pandemic has revealed stark truths about what type of work our nation needs to function. As a frontline employee, society has forced you to operate in a contagious environment. Are you eligible for workers' compensation if you get sick? Keep watching to learn what's being done about workers' compensation cases amidst the coronavirus pandemic and what resources are available. COVID-19 claims. We generally think of workers' compensation claims as having to do with injuries, but there is one other category that may serve workers during this unprecedented time of employment risk: occupational disease. According to the law, a worker may qualify for compensation if they acquire a disease or disorder based on specific workplace risks. Historically, these types of conditions have included illnesses like cancer, skin diseases, or respiratory diseases. So what about the coronavirus? Since each state determines its own workers' compensation laws, state leaders have been scrambling to adjust to the new reality. The waters are murky at best when it comes to workers' comp law. Some jobs will have more grounds for occupational disease claims than others. Frontline medical workers. For a successful COVID-19 related workers' comp case, an employee must prove they contracted the virus while on the job. For frontline nurses, doctors, and paramedics treating coronavirus patients directly, exposure to the virus has become a daily reality. Some states have acknowledged this risk and have extended workers' comp to include COVID-19 infections of healthcare workers. Washington was one of the first to make this explicit as of March, and other states have followed suit. Despite the risk healthcare workers face, many states do not guarantee coverage for their frontline medical staff. With the novel coronavirus existing in such everyday spaces, most states have yet to define it as an occupational disease. Some healthcare workers may still find themselves out of luck. For example, a nurse working in a state with relatively few outbreaks might not be able to qualify. For everyone else, whether you are a grocery store clerk, postal or UPS worker, sanitation worker, or a non-medical employee at a health clinic, you may still find yourself at a high risk of exposure. One of the biggest obstacles is that the virus exists everywhere. Someone may face exposure at work, but in reality, the risk is all around. So unlike, for example, the chemical exposure from working an industrial job, there is no way to pinpoint exactly where one might have caught COVID-19. What to prove? As the disease continues to spread, it may be more difficult for an employee to prove they contracted the virus at work. The most likely situation is where a worker contracted the disease from an outbreak at a facility. If a COVID-19 outbreak occurred at a factory or enclosed space where you work, you might be able to argue that your illness is an occupational disease. If you fell ill because your employer continued to operate normally, you may have a case. The effects of a workplace injury can last a lifetime, and you need to ensure that you and your family receive adequate compensation. One thing is sure, your employer is not going to push a claim. You need to take firm action on your workers' compensation case, and you're going to need help. We have decades of experience with workers' compensation cases. Contact us today so we can ensure you have the support you need for a successful claim. And if you found this video helpful, be sure to like, comment, and subscribe.